Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. The City of Hope is a world-renowned research and treatment organization for cancer, diabetes, and other life-threatening diseases. Well, today, in the midst of Breast Cancer Awareness Month, we have Courtney Bitz. She's Director of Clinical Social Work in the Department of Supportive Care Medicine at City of Hope. She's joining us to discuss the Couples Coping with Cancer Together program. She's joined today by Gayle Whittemore. Gayle's a breast cancer survivor. She, along with her wife, raised $200,000 and collaborated with City of Hope to start this supportive care program. Welcome to Health Professional Radio, both Courtney Bitz and Gayle Whittemore. Thank you both for taking the time this evening.
Thank you. Happy to be here.
Yes, likewise.
Well, Courtney, if you would give us a bit of your professional background briefly, and then Gayle, if you would do the same.
Sure, yeah. So I'm a clinical social worker by training profession. I've worked in the field of oncology for the last 20 years. I'll date myself here, but really have been focused on really my passion in terms of the unique needs of patients and partners and couples when navigating the cancer, a cancer diagnosis. Mm-hmm. I think, most importantly, I want to talk a little bit about that I'm a member of the Department of Supportive Care Medicine. But I think this is really what makes City of Hope unique. And the department really is at the heart of City of Hope's, mission to treat the whole person. And I think that's what we'll be talking about a lot today. And I want to make sure that I talk about the integrated team that I work alongside with, because it's pain and palliative care physicians, it's psychiatrists and psychologists and researchers. And we're all been focused on really minimizing the impact, the psychological, emotional, practical distress that patients and their families can experience. And I think this is something that's really unique about City of Hope. Oftentimes, these different experts are in different, departments and silos, and it's really hard for patients and their families to navigate this to get the help that they need.
And Gayle, a bit about yourself.
Sure, thank you. Yes, professionally, I am a CPA by trade and have spent the last 30 years of my life working with social service nonprofit organizations, very large multi-government funded organizations in the field of mental health services for children and families, as well as foster care and adoption and a gamut of other community-based programs. So I am currently a CFO at Children's Bureau of Southern California, which is a wonderful organization. And as mentioned, I am a cancer survivor, soon to be 10 years come this January, and a recipient of the wonderful services that City of Hope offers.
What was going on in your life when you were diagnosed?
So I was diagnosed back in January of 2012 and had a very uncomfortable itchy sensation in my left breast, a kind of a discoloration in my nipple area that came and went over the course of about 6 to 9 months. And my wonderful wife really encouraged me to get it looked at. And so that's how I ended up eventually procrastinating along the way, getting a biopsy done with City of Hope in January of 2012. And I was diagnosed with Paget's disease, which is kind of a rare form of cancer in the nipple. And quite honestly, they did an ultrasound, a mammogram, an MRI, and that did not show any cancer. It was really my own, and with my wife's assistance and my mother, who's a cancer researcher, to get me into City of Hope to get it evaluated professionally. And that's how I came to be at City of Hope.
Now, Courtney, you did say that you wanted to talk about the work that you were doing there at City of Hope and your team. Give us a look into what it is that you do and how you mold that team into an effective force.
Yeah, I think one of the things about, City of Hope in general is that we are often, those disciplines that are often there to support patients and their families, like I said, with some of the emotional, kind of psychological, and, even the practical needs are often separated from medical care. They're kind of seen as an addition, or if a problem occurs, then we'll do something about it. And I think the unique thing about, especially in the women's cancer program, in partnership with, many of the oncologists and surgeons, is that we've really been able to integrate this supportive care into just the standard of medical care. It's not something that, added on, or it's because somebody or some person or family is having a problem, but it's really, really part of the fabric of what quality cancer care is. And I think that's been the piece that's been, especially, with the couples program, we've been really successful in that because of that commitment, not only from, like I said, the supportive care team, but the oncologists and the physicians who really want their patients to have that whole patient-centered care, of what really matters to patients and their families.
Gayle, was Couples Coping with Cancer Together an idea where you wanted to raise money from the beginning, or was this something that happened after the inception of this program?
It really happened both at the inception and during the course of the developing of the program. And it came about because, of course, I went through the chemotherapy, I went through radiation. I ended up in the hospital at City of Hope with a very bad infection during the course of some of my treatments. And the City of Hope was just absolutely wonderful. And my wife, who would bring me to these treatments and rush me to the emergency room, she had a very hard time. And we realized that it's harder on the caregiver than it is on the patient, because we can feel a level of pain. We know what we want or need. And it's very hard for the caregiver to try and to be in the unknown, to be in the dark, to not know how to best help the spouse or loved one that's going through cancer. And it was at one of these kind of low down times when I had gotten that large infection and was at the hospital there on the City of Hope campus that my wife, Alex, went for a walk through the Rose Garden and thought, what can we do? We know that we wanted to support City of Hope, and she had been a supporter for many years prior to my being diagnosed with cancer at City of Hope. And it really came to her that she wanted to start a program and invest in a program for the couple, for the family as a whole, and to provide, as Courtney said, the socio-emotional kind of help and support that the families need. And that's when we broached the idea with our oncologists, Joan Mortimer and Laura Kruper, and then Courtney, of course, came in, and we started kind of brainstorming through. And that's when we went out and actively tried to raise the seed money to get this program up and off the ground.
Was there anything that you'd like to add about the Couples Coping program?
No, thank you. I think one of the things that I'd like to leave with your listeners is that even in the healthiest of relationships, partners can struggle with how to best support one another, communicate with each other, and solve problems together. And I've seen, the positive impact on couples when they recognize that, cancer is the problem and they're not the problem. And so I want to thank, both Gayle and Alex for talking openly and courageously about some of the challenges they and their family experience, so that other couples might also feel comfortable talking with one another and seeking help if needed.
Now, I understand that this coming November the 7th, City of Hope is hosting its 25th annual Walk for Hope, and you're celebrating 10 years of being cancer-free, as you stated earlier. You're also a patient ambassador at this year's Walk for Hope. What does that mean to you?
Oh, my gosh. I know, it's so exciting. 25th anniversary of the Walk for Hope. It is, we're thrilled. I was thrilled to be asked to be the patient ambassador. And, truly, this is an incredible event, and it's an event that has really far surpassed geographic boundaries, because the event, of course, is virtual this year with the continued pandemic. And we have an opportunity. It's not just to raise funds to support the women's cancer programs and also the Couples Coping for Cancer program, but it's to raise breast cancer awareness in general, and certainly screenings, which we know has been delayed by the pandemic. And, I am the product of standing here in front of you, talking to you, because I took it upon myself to get myself in to get a biopsy because I knew something was wrong. And so I want to provide awareness through the City of Hope, and virtually we can do it throughout the entire country, even internationally, to form teams, and because cancer impacts so many of us. So it's an incredible privilege, and I'm thrilled. We're helping to raise the largest goal yet. And I'm also thrilled that it also goes to support Courtney and the work that she's doing with the Couples for Coping with Cancer program.
Well, if you would give us a website where we can learn a lot more about City of Hope and about the walk as well.
Yes, you can learn more at cityofhope.org and walkforhope.org.
Well, I appreciate both of you joining us here on Health Professional Radio. It's been a pleasure. Thank you so much, and congratulations, Gayle, and thank you so much, Courtney, for the work you do.
Thank you very much.
Thank you.
Pleasure to be here.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also listen in and download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.